Yeah.
Okay, all right. So I am going to walk you through some of what the public opinion polling has said in the lead up to the federal election, what Canada's mood is. With everything I'm about to show you is public opinion research that happened before the writ actually came down. And as anyone watching from the news yesterday and this morning, elections are live, anything can happen, and opinions can shift. So I just want to give that caveat out there. And before I start, I want to just let you know one other thing. I'm doing this webinar from my home, my condo, and on Thursday afternoons, my condo building does its fire alarm. So if you hear a screech, I'm just going to press go mute to try to spare you from the screeching. So it's like I'll be okay. You know, a screech and I disappear. It's fine. I'll be okay. And throughout this, I've got a few poll questions because we have that ability to do that. So my first poll question for you is: which federal party in Canada do you think is leading so far in this election cycle? The Liberals, Conservatives, NDP, or Green Party? Please vote now. Okay, and can we show results?
Yeah, they are showing right now. So we have neck and neck, the Liberals and Conservatives, with 10 votes or 43% for the Liberals and 11 votes or 48% for the Conservatives, 2 votes, 9% for the NDP, and 0 votes for the Greens.
Okay, so let's see if you're right. Oh, I'm having trouble moving this forward. There we go. So here's the polling consensus. It's a tight race, neck and neck between Liberals and Conservatives, with the NDP falling not very closely behind, and the Greens actually nipping at the NDP's heels. That's the Abacus data, but ECOS has similar, slightly different numbers, but similar findings between Liberals neck and neck, and then Greens in heavy competition as well. And there are regional divides. The West tends to lead Conservative, according to ECOS polling, with BC, 32% of people in BC tending to lead Conservative. In Alberta, it's 63%, it's 61% in Saskatchewan, and 45% in Manitoba. Central and Atlantic Canada is tending to lead Liberal at this stage of the campaign, with 39% in Ontario, 28% in Quebec, and 37% in the Maritimes. And in each of these regions, Conservatives, according to ECOS, has been running a close second throughout the summer, actually. There is a gender split. Men tend to lean more toward Conservatives, and women tend to lean more toward the Liberals, according to ECOS. And there's an age split as well. So if you're 35 and over, that age bracket tends to lean conservative, and that tends to grow with age. And the 18 to 34 set tends to lean Liberal, according to ECOS. There's an education split as well. High school or college educated tend to lean toward Conservative, and university educated tend to lean toward Liberal, although there is an age correlation there as well, according to ECOS. So who tends, here's another poll question for you, so get ready. Who tends to vote Conservative? The working poor, the working class, the middle class, or the upper class? You can vote now. And while we're at it, who tends to vote Liberal? The poor, working class, middle class, or upper class? Please vote and submit now. And just let us know what those findings are.
Okay, I think we've had most people vote now. So in terms of who tends to vote conservative, 65% voted upper class, with 26% saying the working class, and then just 9% said middle class. Whereas for liberal, we have 61% saying it's the middle class, and then about an even split between working class and upper class, 17% versus 13%, and then 9% saying it's the poor who vote liberal.
Okay, so let's see if you're right. Oops, here we go. Okay, so for the class divide, the ECOS polling shows that the poor and working class tend to lean conservative. The middle is split between conservative and liberal, and the upper class is decidedly liberal. So there you go. And for the next question, oh, somehow we're missing the, okay, yeah, that answers both. Okay, the next poll. What are the top 3 issues for Canadians? Deficits, carbon tax, climate change, cost of living, healthcare, or the economy? So you can pick, I think we can only pick one here, am I right?
I think possibly. I can't, I'm not entirely sure. We'll have to see what our participants.
Okay. Yeah. So pick your top one, and then you can report back the top 3 out of everybody. Does that work?
Sure.
Okay, great. Okay.
Okay, and yes, we're hearing back that you can only pick one option.
Okay, all right. So let's pick your option. And I'm forced to submit. I think you can see what I vote for. I'm not necessarily giving you the right answer in my vote.
Okay.
Whoopsie.
All right, so based on 85% of the participants having voted, we're seeing the top 3 issues are cost of living, healthcare, and economy. Okay,
so let's see if you're right. According to NANO's polling, 73% said ethics in government, 66% said the economy, and 53% said the carbon tax. According to Forum research, 26% said the environment, 25% said the economy, and 16% said health. According to a CBC commissioned poll, 32% cited the cost of living, 19% cited climate change, and 10% said my health or the health of a family member. And according to Ipsos, 50% said healthcare, 33% said climate change, and 33% said taxes. So you can see there's not necessarily consensus on the top 3 issues. So is healthcare a factor? Because many of us on this call, work in this area, and for us, that would be a huge factor. And so Ipsos did actually an interesting survey asking people, would healthcare be a factor, and how to improve healthcare? So how to improve healthcare, 44% said ensuring there are enough healthcare providers doing the work. 35% said Pharmacare would be a way to improve healthcare, and 33% said improved access to mental health services. And that last one, mental health services, has not historically been one of those top factors that get cited. So it tells you how much the mental health issue is actually seeping into public perception, and it's changing in terms of the Overton window. It's becoming more a mainstream idea where people are saying we need to do more on this front. So then Ipsos asked those people that they surveyed, they said, if healthcare swayed your vote, what are your top motivators in terms of issues? And so for people who said healthcare would sway my vote, 96% of them said mental health access. And 94% agreed with the patient's medical home vision, which I'll tell you just in a second. and 75% said Pharmacare. Now, when you see people agreeing at the 96% and 94% level, that's really rare. I mean, you could probably ask anybody, like, what's the weather outside today? And you probably wouldn't get 96 or 94% of the same answer. So, so you really see a critical mass around these issues for those who say healthcare is a factor in voting in this election. So I said I'd tell you a little bit about that patient's medical home vision. The people who were surveyed were given this vision that included high quality practice care, family practice care centered on needs of the patient, with a dedicated team of health professionals that are working within their community and servicing people throughout every stage of their life, with integrated with other health services. So basically the gold standard for healthcare provision. So 7 in 10 that Ipsos surveyed said they were more likely to vote for a political party that adopted policies to tackle Pharmacare, 68% more likely, more or better mental health services, 71% more likely. And I need to reiterate that this is really new, that you would see this issue top of mind here. And then 69% said that patients' medical home vision would make them more likely to vote for a political party. Pharmacare, a lot of the parties have been talking about Pharmacare, and you know, there is the question, could this election be a referendum on Pharmacare? There was a federal advisory committee report that advised the federal government to once and for all implement universal Pharmacare. The response to that is the Liberals have said yes, but they won't impose that Pharmacare on provinces. The Conservatives haven't really revealed their full platform yet, so it's not clear where they would go on this one. The Green Party was actually the first federal party to advance Pharmacare, and the NDP is going all in. They were the first party with their full platform out the door, and it includes a national Pharmacare plan. So here's an overview on where the NDP stands on healthcare. So they're promising universal Pharmacare, free mental health care access, access to eye and hearing care, a roadmap for dental care in the Canada Health Act. They are also promising to confront the opioid crisis, to prevent the sale of blood products, to tackle wait times, improve access to primary care, create national and long-term care standards, and to have recruitment plan for doctors, nurses, and health practitioners. The NDP on social determinants of health are promising universal childcare, a basic income pilot, and that's a first federally for someone to talk about a national basic income pilot. And so the Overton's window is moving on that as well. And a national food policy, they're promising to extend EI sickness benefits to 50 weeks and to review income security programs. They're promising national affordable housing. They're promising to end homelessness within a decade, and they're promising a national autism strategy. And that's a first too, and that tells you how the window is changing in terms of public awareness about autism and the need to service families better on that front. The Liberals have not, so this report back isn't even because not all political parties have put their full platform out. So I can only report on the other parties as they come out, you know, announcement by announcement. So the other parties will probably be offering a lot more than what I'm able to report to you on. But it looks like I'm reporting more fulsomely on the NDP. It's just because they've got their full platform out for me to look at. So the Liberals on social determinants of health, they're promising Pharmacare, more affordable housing, and aid for seniors, for post-secondary students, and for struggling families. And then they just recently announced that they would fund the addition of 250,000 more childcare spaces for before and after school. The Conservatives on Social Determinants of Health, again, their platform is not out. The only thing that I could find on their website related to social determinants of health was a health and social programs guarantee, which that's what they're calling a guaranteed increases to the Canada Social Transfer and the Canada Health Transfer. And so final thoughts here, looking at how these issues are shaping up, and at least how the discussion has been until about 24 hours ago, before the election and early into this election, we're seeing a dynamic similar to what we saw in the Ontario provincial election just last year, where the Liberals and the NDP were putting forward a platform based on care, you know, Pharmacare, childcare, seniors care, health care, dental care. And there was a contrast between them and the Conservatives who were campaigning on a platform of, you know, cost, the deficit is too high, and who do you trust to bring that under control? And they were submitting that they were the ones to trust. It definitely also was a trust trial for the premier of the time, Premier Kathleen Wynne, and you know, she and her party had several controversies, as any longstanding governing party tends to have in this country, and at the end of the day, cost and trust won out over health, over care. So it's a question as to whether that dynamic will play itself out in this election. Now, I just added this this slide, this final slide this morning as a result of the campaign development yesterday. You know, I've long said that campaigns are live. Anything can happen and campaigns matter. People may think they have their minds decided before the campaign happens, but it always depends on what happens. And so yesterday's news about Trudeau, a younger Trudeau, dressing up in brown face, blackface, and Trudeau acknowledging that that actually was him, and that it was an error in judgment, and that he apologizes. It does shift the narrative, especially since this is happening very early into the campaign. And so, you know, earlier I said, could this be a referendum on healthcare, on Pharmacare? Could this be an election based on care and healthcare? But now I'm adding a new question to the mix. Could racism become a factor? And just moments before I came on, I saw a slide from the Innovative Research Group, who actually did a survey of Canadians that found that 1 in 4 Canadians experience discrimination daily. And they polled and said, okay, out of those who experience discrimination on a daily basis, which leader is more favorable to you? And in that poll, Trudeau's favorability was the highest among them. And so, you know, like I say, elections are live and anything can happen, and all of this could shift on a dime. So there you go.
Okay, thank you very much. We will now continue with our presentations, and it is my pleasure to turn things over to Frank Welsh.
Cool, I just got the nod to start. Hello, and welcome, and thank you for showing up tonight. My goal over the next 15 minutes or so is to talk about how the election might actually influence the bureaucracy, and what are some of the major issues that are on the table for CPHA, the Canadian Public Health Association, as well as a group called the Canadian Coalition for Public Health in the 21st Century, otherwise known as CCPH 21. But as a reminder for everyone, our election takes place on October 21st, and that's 33 days away. And as you know, as Trish just said, Elections are live and anything can happen in the next 33 days. So I have to sort of see how this plays out and actually see, it would be fun to see where your minds are at now and as we get into the polling, but unfortunately we won't get there. What I'd like to do is, first of all, talk about what the purpose of this election is. And really, when you get down to it, it's to find 338 volunteers to fill the seats in this building, which is the House of Commons. It's, and I say they're volunteers because they are. They don't get paid unless they get elected. And that's a key issue. But let me talk a little bit about the type of government we run and why it's important to get out and vote for those people so you can fill those seats. It goes back to the type of government that we are, and it's a Westminster, it's called the Westminster form of government. In Canada, it's been in place for about 152 years, and it's not going to change a great deal over that in the future. And is very distinct from the way an American government is run. I won't go down the American trail, so let's just take a couple minutes to focus on Canadian government. We say it's called the Westminster government, and that's because it's based on the model out of Great Britain, and which finds its roots in actually the Magna Carta from 1215, and then a true lower house of commoners was established in 1341. So government has been around in this form for a long, long time, and it's survived all kinds of activities. So don't expect it to change. When we get into looking at what that style of government looks like, please, next one, you see in front a bunch of boxes. The top two, the Governor General and Senate, are appointed. Down at the bottom, that's actually the bureaucracy of the organization, where the first three boxes are central agencies, and then you have all the departments. And right now we're feeling those departments are all run by a minister who sits in a body called cabinet, who is led by a prime minister. And that prime minister is actually the leader of the party with the most seats in the House of Commons. So that's why making your choice and voting is highly important. Question is, when you're an individual in this process and go into talk to your government and you want to say you have an issue that's burning to you, you have to understand where our Constitution allows governments to work. So if we go to the, yeah, perfect. You have actually three types of powers that exist within the government, this Westminster form. The federal government, which has its series of international relationships, monetary policy, and that like, where they are directly responsible for managing those things. The first one also is POG, which stands for Peace, Order, and Good Government, which is a catch-all piece. However, we have the provinces who, under the Constitution, the original Constitution in 1867, have authority over a number of issues, one of which is health. So where our federal parties may say they're going to do wonderful things with health, they also have to be able to bring the 13 other governments, the provincial and territorial governments, along to agree with these activities. So it becomes a matter of balancing the 14 governments that form the Federation of Canada. And how do you work to establish the relationships and make things happen? Then there are the concurrent pieces, one of which is environment. So all those good things about environment, as we've seen with carbon tax, court cases and legislation are up for debate as to who's responsible for actually taking care of those issues in a government. And we'll see where the courts decide on that one around carbon tax. So lots of moving parts that have to be balanced as we think about what's next for government and how does that influence policy making. So if we, in front of you is a bit of a diagram I developed over several years with some folks in Gov about how policy is made in government. And the part of that policy development that we're really talking about is that bit up in the upper left-hand corner, where you all as voting age people can come in and vote on a party platform. And as we now know, thanks to our last Liberal government, that party platform directly informs their government's priorities. And we also know what the ministers are being told to work on now. So in fact, we're really very much asking questions or looking at moving the way the various political parties think. The challenge with that is most of our parties have decided on their platforms a year ago in a series of conventions that were held through the summer of 2018 and into the fall. So can we actually change their opinion, or are we actually voting on recommendations these parties are bringing forward for action? And in my point of view, it's much more the latter than the former. However, we are all interested in okay, before I get down that path, let's go to our next slide. And really what we're talking about is party platforms. The elected party has the greatest say, so they get to establish the government priorities. They let out those priorities through a variety of mechanisms that are listed on that slide. And the way people measure how well they're doing is what has been passed, but also in the reporting back from the departments to the Parliament. So it's an interactive process, and there, as I said, a number of moving parts, and the real challenge then is to ask, how can you influence those parts? Well, I think there are two ways we can do that. First of all, there's reviewing, the next slide, looking seriously at what the various parties are proposing, becoming informed, and then finding out whether your member of parliament or the candidate for a member of parliament actually is aware of what their parties are saying. So attending those community meetings, getting involved, asking questions. I've noticed, at least in my neighborhood, our candidates have been doing a lot of walking around, knocking on doors. And that's a real good time to ask a question. One of my favorite topics is the role of science in government. And if you ask that question to one of the parties, you get a relatively positive response. And if you ask it about some of the other parties, you get a very negative response. So there are differences out there, and it's up to you to become informed and decide where you sit on the topic. But equally as important to finding out where the parties sort out and your role in both evaluating what you think of them and casting your vote, it gives us a unique opportunity to meet potential members of parliament and to ask them questions about issues that are of importance to you. It's actually a pretty unique opportunity, and it really happens only every about 4 years when there's a major election. And although it may not be an opportunity to really make a big, broad statement, it gives you a chance to influence those people as they work within their parties. So to help both this group called CCPH 21 and ourselves, CPHA, we've identified a number of issues that are important to us from a public health perspective, and package together pieces of information that you can comfortably go into our websites and find and look at. The areas that were most important to CCPH 21, in which CPHA has agreed to are the top 6 pieces: basic income, climate change, ECEC, or early childhood education and care, core housing need, opioid crisis, and racism and health. You'll see a lot of those actually have the roots, some of the position statements we've been developing and releasing over the last 3 or 4 years. There are also 2 other areas we find very important. One is the issue of decriminalization of substance use, and you'll see it. We go into more detail around what that means within our actual position statement from 2017, and also public health and health system renewal, which has become much more forefront for public health practitioners. And it's how do we ensure that government structures and funding are in place to maintain public health over the long term. Because there's the perception that budget cuts and reorganizations are weakening public health practice by many practitioners. So where can you find the information to support that piece? Next slide, please. Well, there are 2 websites I'm going to point you to. For CCPH 21 material, it's the website on the right. But for CPHA, where we have much more in-depth materials around the latter 2 issues, we also post our summary pieces for use by you as public health practitioners that include a short summary of the issue, why it's important, and a series of questions you might want to point to the candidates in your writing. So I think if you're at all interested in what we're doing and how you might influence some of these people, please take a look at those pieces. And if you have the opportunity, raise the issue in the meetings. So why don't we go to our last slide? While those 8 pieces, you can see links back into some of the party platforms. Many of them don't resonate at this point in time. So it really is, in this election, a case of looking at the various party platforms, deciding who most aligns with your viewpoints and you wish to support, and then go out and cast that vote, because it's your democratic right as a citizen in this country to express your opinion through the election. So with that, I'll turn it back over to Emma and we'll go to questions, I guess.
Yes, thank you so much to both Trish and Frank for these presentations and this election primer. Mm-hmm. We have quite a bit of time for Q&A, so I encourage all participants to submit their questions using the Q&A box. We hope to spend some time now on your most pressing questions.
Maybe I can pose a question to Trish. Sorry about that, Trish, but I hate silence.
That's okay.
Really is a question about what influence that a faux pas such as our Prime Minister did in his past life might have on an election at this point.
That's an excellent question, and it could go a number of ways here, and we don't know what other faux pas are going to be unearthed with any of the leaders or any of their candidates. So it could be a bumpy ride for all, but essentially for if you're a political leader, trust is a huge issue for voters, and so it depends. Negative attacks, negative issues can resonate more if you actually question the trust that you have in that political person that candidate. And so this is one of those situations where it really might be the trust thing. The Conservatives have been campaigning around the frame that Trudeau is not what you think, and so revelations like that can play into an opponent's frame. You know, on the other hand, where do those votes go if people are actually questioning the trust in that? And so there could be a lot of movement in the next couple of weeks, and a lot of what I showed you in terms of where public opinion is at, it could shift. But the other factor here is what are voters' like key issues? What would really move a voter to go from candidate A to candidate B? And is this an issue that might shift them or not? And that's a question that should become evident probably in the next week. You'll see whether polling is shifting or not. But going back to what I said earlier, campaigns are live, anything can happen. And, you know, I'm gonna put my neck out there and say, this is not the only faux pas that we're going to come across in this election.
Thank you.
Thank you very much. Please don't be shy, and please send us your questions. I'll ask another question to either Trish or Frank, and that's about the coverage of the campaign by media. So if someone's following along by reading what's in the media, mainstream media, as well as social media, versus really trying to inform themselves by speaking with the candidates locally that come door to door, or reading the platforms that are available online, watching the national debates. You know, how do those sort of compare and contrast?
Sorry, Emma, do you mean like how you get your news and how you get your information?
Exactly, how you get your news, how you get your information. What does the media tend to focus on during a campaign versus what, you know, the candidates and the parties are trying to put forward?
Got it. Okay. Okay, let me try to tackle this a bit. It requires a bit of unpacking though. So there are actually neuroscience studies that show that public perceptions can shift. People can change their mind or make their voting decisions based on getting a repeated message that appeals to their value set, getting that from multiple trusted sources. And so what are those trusted sources? The neuroscience studies show that family and friends, what you hear from family and friends, can be a huge predictor there. They can really sway you one way or another. Mainstream media is another place that some people they trust what they hear on one media outlet and maybe not so much on the other. You know, sort of the American comparison, you know, the people who watch Fox News may not have the same, be influenced by what they hear on Fox News as much as the people who don't watch Fox News. So people choose and flock to certain mediums as well. And especially with the advent of social media, many people are curating their own news feed. And so you might be in sort of your own echo chamber, hearing more and more from people who are like-minded, and that might harden or reinforce your existing beliefs and value systems and perceptions of a political candidate or party, or it could be part of what makes you start to change your mind. But the neuroscience here is clear. It isn't just that we, you know, get a set of facts and that either reinforces our belief system or helps us to have a shift in what our perceptions are about an issue or a person or a party, that facts alone don't do it. It has to be, it comes with a narrative, and a narrative that is based out of value systems. And there's George Lakoff has done a lot of work in the US about how issues are framed differently, whether you are small c conservative or small l liberal in terms of your value system. And so, so different stories can make you feel something different. And so when politicians are trying to change your hearts and minds on something, they're not just giving you the facts, they're telling you a narrative, a story, and they're having you go through their frame, their lens, in order for you to see what that issue is. And that can reinforce your belief system if it actually appeals to your current value set, or it could turn you off. And I mentioned turning off because there is also a lot of literature that shows that there are a number of people, particularly swing voters and younger voters, who in a negative election campaign really get turned off by the polarizing nature of the debate. And the more they get turned off, the less likely they are to actually go and vote on voting day. And the history of the last 20 years of elections in Canada, certainly federal and provincial, shows that when youth voters turn out en masse, the outcomes tend to be a more progressive government formation. And when they don't, when there's lower youth voter turnout, it tends to be a more like small c conservative leaning outcome as well. So the youth vote matters. It can make all the difference in an election.
Wonderful. Thank you so much. We do have a few other questions in the queue, so we'll move on and take those questions in sequence. One person was asking about how we will pay for some of what's being promised by the NDPs and their platform. So there was a list that you showed earlier of health and social determinants of health items. But how will those how will those be paid for, and will there be cuts?
Perhaps I can start on that. That's a really good question. Excuse me, because many of the items the NDP are raising are really high ticket, are very expensive items to develop and implement. And yet they haven't signaled what they would do around their fiscal or economic program, because in the end, all the costs associated with programs established by government come out of the taxpayer's pocket, whether it be the individual taxpayer or the corporate taxpayer. And in doing that, looking at that construct, you have to ask whether or what is the willingness of the taxpayer to pay for additional services that they may or may not be using. So until they actually sit down and talk about their financial programs and what they would do to strengthen the economy or increase taxation or decrease taxation, depending who you talk to, will really dictate what they can actually achieve from an economic perspective.
Thank you, Frank. Did you have anything to add to that, Trish?
I do, and it is a really important question. And for some people, it's the only question, can we afford to do this? And on that part, I have three thoughts, and that means I've just guaranteed that I'm going to forget my third thought by the time I get there. But only the NDP so far has talked about the fiscal platform and what they would do, and one of the things that they're advancing is a higher taxation on the wealthiest in Canada, and that does play into the research from multiple sectors and from Statistics Canada itself that shows that income inequality has been growing in Canada over the past generation, and so it's been growing at a time when the tax system has become less progressive and more regressive, where we actually haven't been taxing the wealthiest at the rate that we did historically, and particularly in the years after the Great Depression and the Second World War, from the 1950s to the 1980s, when Canada was busy building its middle class. It was doing that because we were actually asking those who have more to contribute more by way of taxes. And that feeds into a pet peeve of mine around how we talk about how we pay for programs and taxation before, after, and during elections. And I think it's really important because my pet peeve is that we often reduce Canadians to taxpayers. And when we put Canadians through the taxpayer frame, then that individualizes the discussion. It's about me and mine and what government is taking away from me. And it divorces the conversation from what it is that our taxes buy. And, you know, my parents' generation and my grandparents' generation actually paid more taxes as we were growing that middle class. And those taxes were the things that helped us create things like universal public health care, like more affordable university, and public transit and affordable housing. And that's what we did collectively through taxation. We were able to use those revenues to create programs that benefit everyone, even the rich. Those universal programs. And so I think sometimes we get too divorced from what those taxes actually buy us. And so, so I'd like for us to think about that, because we're not just taxpayers, we're also citizens, citizens who hopefully are, you know, promoting a vision of Canada where there's decent work, there's less income inequality, where everyone has a chance to get ahead. And taxes are how we do that collectively together. They're the gift that we give each other. And the third thing that I wanted to say, and I actually remembered, and I normally don't when I number my thoughts, but the third thing that I wanted to say is there's actually research that shows that, that taxes are actually Canada's quiet bargain. The Canadian Centre for Policy Alternatives released a major report a number of years ago that showed that the average middle class family actually saves about $40,000 a year in terms of what they get from public health care, you know, all these other public services. So again, the fixation on taxation tends to move what the public services that they buy us and what costs that Canadians might be facing otherwise if we didn't have those public services to provide. And so I think that's really important to think about. In my final note, and you know, Upstream is an organization that really looks at the value of social determinants of health and talking about that and getting to the root causes of health outcomes. And we can't do that unless we invest in these sort of things. And we often don't talk about what, if we had a universal dental care program, how much that would actually save Canadians money. It would save us in terms of people who can't afford dental care often struggle then with related health issues that we end up paying for. I mean, they pay for personally with worsened health outcomes, but we end up paying for it through higher healthcare costs as well. So I really like to complicate this conversation.
Thank you very much. Those are really very helpful responses. There was another question that came in about strategic voting in this election. And do you think that a stronger NDP or Green Party might lose the Liberals some votes and lead to a conservative government? I don't know if you want to go first, Trish, and then just so you know, there is one other question as well. We're looking at overall time we have left.
Sure. You know, I think my greatest disappointment over the last 20 years is that elections often get reduced down to strategic voting questions, that anybody but this candidate kind of approach. And I actually think that diminishes democracy, and it diminishes the conversation about who's actually putting forward the best ideas for a more equal and inclusive society. And I would hope that we would move toward that. Now that said, you know, one of the cures to the strategic voting conversation would be proportional representation. And so taking a look at if any parties are actually putting that on the table, then maybe that's the way that we could actually move beyond the perennial who's the worst or best candidate, and do I have to hold my nose when I vote. I'd rather people get excited about their democracy and vote for something rather than against.
Mm-hmm.
Yeah, I'm of the same opinion. You should look at what people are offering and make a decision based on your morals, values, ethics, to support those who are most aligned with your vision and viewpoint. And parties will lay where they will, and the numbers of seats will sort themselves out. But I believe it's more important to have that internal discussion about what is most representative of your actual views, values, and ethics, and allow that to direct your voting.
Great, thank you so much. We have one last question. How can new immigrants who are not eligible for voting, so non-Canadian citizens, get involved in the federal election? And can their voice get heard by the candidates?
As a new immigrant, you wouldn't have the right to vote, but you can also attend the candidates' meetings. And you'll be speaking with the candidates when they come walking past your door and looking for your vote. And that's an opportunity to raise your issues with that person. So I would use those opportunities to bring your views to the table.
Thank you.
I would totally agree with that. And I'm so glad that this question was put on the table, because I want to remind everyone, voting is very, very important to a democracy. But democracies happen the vibrancy of a democracy is more than just voting. It's the conversations we have with each other. It's volunteering for a campaign. It's holding politicians to account. It's really getting engaged in society. So whether you're a newcomer and you can vote or not, an election is a good way for you to start getting engaged in those other aspects of our democracy. And that's part of what makes our society richer and our conversations stronger.
Wonderful. Thank you so much, Trish and Frank, on behalf of CPHA and the participants of today's webinar. We hope this was insightful and leaves you feeling better equipped to engage in the election process and to get out and vote on October 21st. I'll just end